I'm Dr Folorunso David Femi, a consultant ENT surgeon in University of Abuja Teaching Hospital, Kopoladam, Nigeria. I'm also a member of International Surgical Sleep Society. I just want to take you through a series of lectures on snoring, obstructive sleep apnea, and sleep disorders generally. Just to let you know that snoring is not normal. Some think it's normal, but I want to let you know that it's not normal, and that is why I want to teach you how to create awareness about this. Yes, you have individuals that occasionally they snore, and then if there are no other background issues you might not worry about it, but when your snoring becomes an issue or something that is chronic or persistent, then definitely you need to evaluate yourself to find out why you are snoring. Because one of the symptoms might just be it might just be to show you that you have underlying issue that you need to sort out. That is to say, when you are snoring, we need to find out what is causing that snoring along your airway pathway, because you have structures along the airway that will obstruct your free flow of air when you are sleeping, which could now lead to snoring. So that is why we want to differentiate you. Either you are just an habitual snorer, or somebody who is snoring due to pathology, due to a disease condition. So I'll need to take you, because it's a series that will take a while. So I need to take you because it will cover almost 14 topics for you to be able to understand why you are snoring, what is causing the snoring, and what can be done, because this condition you can manage this condition. Some are even curing that when we do the needful, it stops. And that is why you need to make yourself available in any ENT clinic. And then if you need more, if you want to know more also, you can call through the contacts on the screen. Now, when you snore, what happens? Yes, we have a condition when some snoring can lead to. One of them among these sleep disorders is obstructive sleep apnea, which is really my intention for this moment to discuss with you, to summarize and follow it with series of lectures. Now, when an individual have a situation when sleeping in which his breathing stops, it stops up to 10 or more seconds, especially in an adult, and maybe above 20 seconds in children, we call that condition obstructive sleep apnea. And when you have obstructive sleep apnea, we want to know the level you are. Is it mild? Is it moderate? Is it severe? And for us to know this, we have to do certain things, which include you must make yourself available for sleep studies, which you can see the video of somebody that just had sleep studies. That's a polysomnography. And there are two types. We have the one hospital based, we call it sleep lab. You come at night to pass the night in the hospital, and the polysomnography machine will be attached on your system, which is in the video that just attached to this, where you'll be evaluated to know, because the gold standard is that you must make the diagnosis no matter how you snore. Some people snore, they don't have obstructive sleep apnea. So the first thing is to make the diagnosis, to find out why, to find out if you have obstructive sleep apnea and the level at which you are, so that will help us to evaluate it better to help you. Also, we also have another type where you can take the machine home and go and use it. This one just about it depends on the channel. Some have 7 channels, 8, 9 channels. So the second one that you can take home, that one just few channels, and this will give us basic parameters you want to know, to let us know if you actually snore, and to also make the diagnosis of obstructive sleep apnea. And at the same time, we know your oxygen saturation when you are sleeping. You want to know how it affects your oxygen intake. You want to also know your pulse rate, because of this problem of not getting enough oxygen. Some their pulse rate tends to increase. So this is basic one. Certainly we use this for patients who, for our own initial assessment, clinical assessment, has not shown features suggestive of complications from obstructive sleep apnea. So we can use this. You take it home. It's very comfortable and very convenient. Especially at the convenience of your home, you can use it. And then you bring it back. You can use up to 3 days if you want. Then you bring it back to the hospital. We analyze it and then be able to discuss with you, and then establish that you have obstructive sleep apnea, or you don't, or if you have, what level are you? While the hospital base, it has more parameters. Some between 22 up to 29 channels. That you could measure almost 22 up to 29 parameters within your system. For example, it has ECG attached. It has the electroencephalogram attached. It has the electrooculagraphy too, and the one even we attach to the legs, the one we attach to the abdomen, which you have seen or you will see in the video following. This is to let you know that this one is more elaborate, it has more parameters than the first one. We use this especially when an individual also has issues with his sleep. Some patients with obstructive sleep apnea or other sleep disorders, they have insomnia. Insomnia means poor sleep or lack of sleep, or you have sleep problem. And this, because it's attached to the brain, it will give us the brain wave what happened to you when you are sleeping, and then we'll be able to evaluate it properly. So this one, most times we want to use for patients that we notice that's already, developing some complications arising from obstructive sleep apnea. Another test we want to do is, yes, we have diagnosed you that you have obstructive sleep apnea. The next thing we want to know is that what is causing this obstruction along your airway. Remember, from the nose down to the larynx, any obstruction along this pathway can cause obstructive sleep apnea. And some of them manifest with the snoring because of the vibration of this soft tissue blockage or some of this blood tissue. So we now need to do another investigation that will give us an idea of where is this obstruction. And the best one we do is to do what we call drug-induced sleep endoscopy. During drug-induced sleep endoscopy, we are going to give you an injection to make you sleep, and you sleep your natural way, so that when you are sleeping, you are snoring. I will now pass. This is the part of the component we use. This is a flexible endoscopy, which we attach it to the camera. When we attach this to the camera, we do this in an endoscopic room or in our theater. When we attach this, it will enable us to find out the part of your airway where we have the obstruction that is causing this snoring. So, but when we attach this, you can see this is a flexible, this is an endoscopic tower. We have the flexible endoscope attached to the camera, which you can see it will show here. So just that when you are sleeping, we can see from the airway where the obstruction is. Okay, you can see this ability to go down. It will go down from the nose down to the larynx. So this will go down. See, we'll be able to navigate your nose, go through your back of your nose, nasopharynx, go through the mouth, oropharynx, and then down to the larynx. So we do this for people that want to evaluate and find out where there's obstruction. By the time we are done with this, we should be able to know where the obstruction is. And you can see also the video of few individuals that have done this. And also, it's also very needful to do CT scan of palatal sinuses. This will look beyond the soft tissue the endoscopy has seen inside the bone column to find out. We are looking at causes of this condition. We know that sinusitis is one of the major also cause of this because of secretion from your sinus infected material that has caused chronic inflammation in your nose, your nasopharynx, and also cause inflammation even the oropharynx. Some tonsillar enlargements are actually due to secretions, infection coming from sinuses. So with CT scan also, it will help us to look at your condition in a holistic approach to know what is generating this obstruction. Now, by the time we do this, we should be able to get situation, we don't know where you are having obstruction. And so, there's no mechanical obstruction, no tissues actually causing blocking. But we notice that when we are doing the drug-induced endoscopy, we notice collapse from the, you can see the video I attached to it. You can see the collapse of the airway. Some we notice very narrowed nasopharynx. Some will see prominent toxins. Some will see uvula blocking, flapping and blocking the airway, and that's why uvula, of course, is called the chief vibrator, and down to the larynx. So by the time you know which part is causing this, and some of these could benefit from surgical approach. And however, we have some too that there's no obstruction that you can go and remove, and it's actually due to pharyngeal wall collapsing. And some of them will benefit from what we call CPAP, continuous positive airway pressure, which is gold standard too to manage this obstructive CPAP when there's no need for surgery, because it can open it down from the nose down to the larynx. We have other appliances people have used. Some have used nasal dilators, some have used a dental prosthesis, or actually there's tongue, a very big tongue that is always falling, coughing and falling into the larynx to obstruct the airway. All of these two they have been used, but generally the advantage of CPAP is that they can work in any part. It takes out either the blockage in the nose, is in the nasopharynx, is in the oropharynx, in the apopharynx. CPAP can take out all of it. For those who don't need surgery, but several patients have done surgery for, the progress has been so fantastic and encouraging. Now, why do you have to attend to this condition? We are creating awareness because we know that close to 35 to 50% of especially adult populations have snoring, do snore, and it decreases with age. What elderly, and that is why we are creating this awareness because of complications. Remember that when you are sleeping at night, your oxygen drops, the tissue saturation also drops, because there are a lot of generations of radicals from oxidative stress, which can lead to, and this can affect any organ. And that is why you discover that the complications of obstructive sleep apnea affect almost all the systems of the organs, because it can affect brain, it can lead to cardiovascular problems. Can lead to brain problems due to cardiovascular accidents. It can also affect I'm trying to link together. It can affect the heart, can lead to hypertension, especially talking of secondary hypertension. You know, it can, with that, it can degenerate to cardiac heart disease. Quite a number of patients have heart stroke, which is the problem from all of this singular problem of just sleep apnea. And it has been shown, you can go through the literature, series of studies have shown that patients living with type 2 diabetes mellitus tends to, quite a number of them have been found to have obstructive sleep apnea. So, and that is why when I look at some of them with type 2 diabetes mellitus, ab initio was as a result of obstructive sleep apnea. We have seen patients. The record is there in the literature of patients having glaucoma from obstructive sleep apnea. So all the major organs it can affect them. It could affect the heart, it could affect the brain, it could affect the kidneys, And on the social issue, it can affect your sleep partner because of the noise at night. And that's why your sleep partner will let you know that at times when you are sleeping, from time to time you stop breathing. That's what we call obstructive sleep apnea, And not just that, it can also affect even members of the public. Because this is some of the symptoms you have when you have obstructive sleep apnea, and I will tell you that can affect members of the public. Like I mentioned, apart from affecting your sleep partner, it can affect other members of the public. For example, if you have obstructive sleep apnea, one of the symptoms you must have noticed yourself is that during daytime you always feel sleepy, feel drowsy. You are driving, you are sleeping on the steering, you are holding meetings. Importantly, for that matter, you are struggling not to sleep during meetings, or several times find yourself just always want to sleep. The reason being that you didn't have refreshing sleep, you didn't have good sleep at night. So you are driving, you are driving on steering, you can run into another vehicle, leading to accident. So that is why whatever you do to take care of this is not just for you, even for the members of the public. Now, other symptoms that will let you know that you have obstructive, that will suggest to you that you have obstructive sleep apnea are: one, when you wake up in the morning, you notice that your mouth, your throat, you notice that you have dry mouth, dry throat. At times you wake up with headache. You notice that you always have headache. You wake up, you feel as if you've not had good rest, unrefreshing sleep. Because you might be sleepy. It's part of the series of lectures I want to give you. Types of sleep and the level of sleep that you get to, that you have refreshing sleep. Because we have rapid eye movement, we have non-rapid eye movement. This is another topic I'm going to deal with. The fact to know that you have a quality sleep. The fact that you close your eyes doesn't mean you are sleeping. Might just be angry, and you don't have quality sleep. You wake up, you feel tired, fatigue. You are so weak. You can't perform well. You can even have confusion. It can lead to amnesia, forgettings. It can lead to you not very aggressive because of sleep apnea. So that is why it's very important to look at this. Complications, they are there if they are not taken care of. Yes, we know we have individual who snore occasionally, but then if you become not stop to just come and do sleep study and find out. So this is my area of interest as an ENT surgeon, to create awareness, to let society know that snoring is not normal. Obstructive apnea, it has terrible medical complications which we don't want to happen to anybody. It can lead to death, stroke, quite number, So it's very important to come and evaluate yourself. You can do this in any ENT centers. Yes, we have the place I go to as their ENT surgeon to evaluate a patient individual with obstructive sleep apnea or sleep disorder. In Abuja, we have 5 centers that I go there as a visiting consultant to help them on this. If you have this problem, feel free to call us. Thank you.